So good afternoon, everybody. Thank you very much for the opportunity to come here and talk this morning. It's very important that I actually share the experience of these Sustainable Development Goals with you. I'm not sure many of you know about the Sustainable Development Goals, but by the end of this conversation, trust me, you're going to know everything there is to know about them. So this, as I said, is a joint presentation. If this would like to work. No? Go. Yeah. Right, so we're going to talk about what are the SDGs. I'm going to describe the SDGs. I'm going to talk about the government policy because there is a whole of government implementation plan on the SDGs. That was needed to these SDGs. The Department of Health has a role in the SDGs, which Greg is going to go into great detail on in our 15-minute slot, Greg. Then I'm going to come back and talk to you about the Stakeholder Forum because the SDGs are a whole of society issue. They're not just something government can do. They're not something civil society can do. They're not something business can do, academia. Everybody has to work together to implement the SDGs successfully. And they were designed that way. Then I'm going to talk about our first voluntary national review, which we gave in July 2018. This was like our school report, where we are in the implementation of the SDGs, and what was good, what was bad, and what we needed to improve on. And that will lead very nicely into the National SDG Champions Programme, which is where we asked business, civil society, and academia to help us raise awareness of the Sustainable Development Goals, show where they're doing good examples that other people could copy, because I said the SDGs, to implement it properly, is about behavioural change. Behavioural change starts with having a good leader. Then I'm going to talk about the next steps, which for me are a lot of work next year. We've heard about writing reports. I have to write the next National Implementation Plan, and then I have to also write a progress report. So that's really the outline of my presentation. So without further delay, I will kick you off. Right, so what are the SDGs? There's 193 United Nations member states signed up to these 17 Sustainable Development Goals with 169 targets. Now, it's an agenda for people, planet, prosperity, and applies to both developed and developing countries. And you notice very carefully, it's a jigsaw. All the pieces fit together. All the plans have to work together. You can't have good health if you don't have issues in climate change, clean air, and poverty and work. So everything fits together in a mesh. And that's very important because we, as a government department, thought that through very carefully when we were designing the Sustainable Development Goals National Implementation Plan, which we launched in April 2018. The Sustainable Development Goals were announced in 2015. Government thought very hard about it. They thought about joined-up thinking, a whole of government implementation, and they developed the National Implementation Plan. Now, that plan is unique because it sets out a policy map. Now, the policy map has where each government department has ownership of Sustainable Development Goals and what their actions are and policies are to implement those targets. And God love Greg, he's going to talk about the health ones shortly. So, my own department has responsibility for 9 of those goals, and 3 other departments have also responsibility for health. So just show there's complete oversight. It's like a web across government of all the different policies relating to the SDGs. So as well as Greg's department, we have Department of Foreign Affairs and Trade, who deal with all the international Irish aid aspects of good health. Department of Transport, Tourism and Sport, because as you know, transport emits carbon. You also have tourism country, but sport, healthy living is very important. And we'll come back to that later on talking about the champions, because that's a very important point. So now, happily, I'm going to hand over to Greg, who's going to talk to you about the Department of Health's role in it, and then I'll come back and go through the other parts of the presentation. So thank you very much for your attention so far.
Thank you very much, Joe. And I kind of like the cameo in the middle. So hopefully I can live up to the expectations. The Department of Health and SDG 3 is what I'm billed to talk about. The SDG 3 goals, there are actually about 9 of them that are domestic in terms of SDG 3. But you can see through them they're quite diverse. They're very far-reaching. There are quite a lot of different government departments actually also involved in those. Things like road traffic deaths isn't something that the Department of Health actually deals with directly, which is why there are 3 different government departments working on them. I've just highlighted the ones where my unit within the Department of Health actually have direct responsibility. The approach that has been taken by the Department of Communications, Climate Action and Environment is to create a policy matrix to identify the policies that are currently in place that touch off against the different objectives of the SDGs. There are 9 policies within the department that directly work towards the implementation of the SDGs. The Healthy Ireland framework is the one that I have responsibility for or work within the department with responsibility for. But there are other things, the National Sexual Health Strategy, the National Action Plan on Antimicrobial Resistance. There are a whole range, including Sláinte Care, which I think is one of the sort of central policies, especially for something like universal healthcare. This is a very sort of traditional civil servant type approach to this. You identify the policies that you're already implementing. This is what you're going to work on. This is what you're going to report on. But I think it's much more complex than that. I took this from the Shanghai Declaration in 2016, and what it says is that health and well-being is essential to achieving the SDGs. And I think climate change, the SDGs, and health and well-being are three issues and three areas of work that are inexorably linked. If we work on one of those, we're working on all the other two as well. So we're all pulling in the same direction. There is a high degree of policy alignment with this. I also pulled this as well from the Shanghai Declaration. And what it shows is how SDG 3 crosses over all 17 of the other SDGs. And it reminds me very much of the social determinants of health that we have within the Healthy Ireland framework. Again, I think it shows how the SDGs and the SDG agenda is the health and well-being agenda. It is what we are doing, and it is what we're doing already, but it is something that we need to be aware of. So in terms of the Healthy Ireland framework, it is a health and all policies approach. This is something that's very, very difficult to achieve, to get other government departments to work on health or to see health as part of their responsibility. We have very good relationships with many government departments, but it is something that's difficult. The risk factors of major diseases or the determinants of health are modified by measures that are often managed by other government sectors and the other factors in society. This is taken from the Healthy Ireland framework. It is beyond the capability of any one government department or organisation to promote society-wide health and well-being. This can only be done through society-wide involvement in and engagement with health and well-being promotion. I think it's really important that we also we go beyond the government sector, we go beyond the health sector, we go into the private sector, we work with community and voluntary groups, and we work locally as well. And this is very much enshrined within the goals of Healthy Ireland, especially where we're trying to create an environment where every individual and sector of society can play their part in achieving a Healthy Ireland. So I just wanted to sort of bring it into something a little bit more practical, and I think it's already been spoken about this morning by Vladimir in terms of healthy cities, and as well by Fergal Goodman. Health is created and lived by people within the settings of their everyday life, where they can learn, work, play, and love. That's taken from the Ottawa Charter in 1986. This is the foundation of something called the Healthy Cities Movement, where cities aim to create a health-supportive environment, achieve a good quality of life, provide basic sanitation and hygiene needs, and supply access to healthcare. I think climate change is a real challenge to how we can go about doing that and how we can continue to do that. But it also speaks to the fact that we need to work locally, that at the local level, a lot of these very large society-wide challenges can be worked on. So within Ireland, we're currently developing the Healthy Cities and Counties of Ireland network. There were 3 members of this network in 2016. We now have 20 members, and we're looking to have full coverage of the country by the end of next year. We will have a new development strategy for the network to be published in 2020. And health and wellbeing plans are being implemented in every county in Ireland under this network. It was interesting to me to hear that we have climate change plans in every county as well. I mean, I think that's one of the challenges as well with working with local authority and to local authority. It's just the capacity of local authority to do all of these different policy things together, and the need to find that policy coherence and to be able to help local authority to provide these kinds of solutions. I think the LCDC review that the Department of Rural and Community Development did recently is an opportunity for government departments to come together to start looking at that coherence, start looking at how we work with local authority. So we're looking to ensure that SDGs are at the core of the objectives of our network members through the Healthy Cities. And I think that's very much based on the kind of the direction of the WHO and where that movement is headed. What we also need to do is provide training and resourcing at local level to realize this multi-sectoral approach. So we take it for granted that our local authorities have the resources, the capacity and the training to be able to do this work. And I think what we need to be doing is looking at how our local authorities are resourced and how their capacity is increased to be able to actually deliver. A lot of our local authorities have budget deficits and are struggling to even provide the services that they're currently providing. So if we're looking to local authority, we need to also be doing something to assist them. And that was my cameo.
I'm back. So I was talking about the Stakeholder Forum. The Stakeholder Forum was a unique part of the National Implementation Plan because, as I said, it's a societal plan. It's not a government plan. So we brought stakeholders together in June 2018 to talk about the SDGs and the practical implementation of the SDGs, because the UN 2030 goals they seem very high level, and we're trying to bring them down to a level where people can understand them. So the Stakeholder Forum is where we basically meet with stakeholders. We talk about goals. We've adopted a thematic approach. As you can see, we had some very interesting speakers. We had the Taoiseach. We had David Donoghue, who I personally blame for the SDGs, because I think we heard earlier that he was responsible for them. But he developed the roadmap, and I had him over the last Stakeholder Forum, and he talked about the vision behind the SDGs. The vision is, as I keep saying, it's a utopian world. If we had the SDGs implemented, we wouldn't be having conversations about climate action. We'd have it all done. So I said to him, that was lovely, you gave us a picture, but you didn't really give us the instructions and the rules. So we're developing them as we go along. And all 193 countries are all struggling. So the Stakeholder Forum is where we discuss that in a coherent way. It's an open invitation to all interested parties. I think we've had 6. We've had 5. The next meeting, by the way, is on the 18th of December. It's on Zero Hunger, SDG 2. You're all more than welcome to attend. The keynote speech in the afternoon by the Minister for Agriculture. We talk about his department's role in relation to food. But we have a thematic approach to the agendas. We haven't had an agenda debate yet on SDG 3, and I'd like to offer that to the Department of Health if they'd like to come as the lead department, and maybe their minister could come at a later date and talk about that one. The stakeholders are very interested to talk to politicians and policymakers because, as I said, it is about talking about where we're at and how we're going to get there. So I'm going to go back briefly in time to July 2018, when I talked earlier how we presented our first voluntary national review. Now, you present these every 4 years to the United Nations High-Level Political Forum. So 193 countries sit there and listen to what you've done to implement the SDGs. We only put the plan out in April, so we were kind of fortunate in 18 that we only had the plan in place 3 months. The Voluntary National Review showed where we're doing really well. We're doing extremely well in terms of our education. We're doing extremely well in terms of some parts of our clean air. We have a very good economy. We have issues in relation to health in terms of obesity, and every time I say that I have to kind of suck the L belly in there, look good. But we also had a huge issue in relation to homelessness and climate action. So taking those two, as I call the red flags on our school reports, the department spent most of 19 writing the climate action plan, which, as John talked earlier, is something that we are going to make sure we get right. But more importantly, the VNR showed where we're going in terms of where we're on target, where we're going to meet and where we're not going to meet. And again, that reflects in policy changes. But the baseline is very important because in 2022 we have to present the next voluntary national review. And my ambition is to make sure that we've moved considerably further down the table in terms of reaching the top rather than status quo. We need to move fast on some of the issues. Earlier this year, we put an expression for champions. Now, champions are voluntary organisations who are exemplars to other organisations, showing what they're doing to implement the SDGs at a local business or community level. We were inundated with replies. We got 76 organisations all wanting to be Ireland's first champions, which was a bit of an issue because we had to go through them and shortlist them, so we kind of were victims of our own success. We appointed 12 organisations recently in the National Ploughing Championships, and they were appointed for a 12-month period. I'm going to show you who the champions are now, and you'll see how they relate back to all the different goals. We have Unpust, we have BIM, we have Carlo, we have Eco UNESCO, the GAA, etc. are very prominent in terms of healthy Ireland. Every parish has a GAA club. Every school has kids who play football. And again, the GAA we're seen as a very major driver in terms of getting people effectively up off their bums and going out and exercising. But we also picked other champions. If you look at men's sheds, they're very good. Again, they're dealing with health in terms of men's health. Musgraves are very keen to develop issues around sustainable consumption and production of products in their shops. And we're hoping that other supermarkets will follow suit, and that's already underway. Carlow County Council are highlighting the good things the councils can do, and I have to say, they are one of my most prolific disciples of SDGs. They're talking to everyone and anyone. And then we have other areas. We have the smart farming, we have the National Women's, we have the Union Students' Violent we Vodafone. So there's a diverse mix of Irish society in those champions. And they are all out there talking to their own networks, talking to the public, raising awareness of the SDGs, because a lot of people keep asking me what these pins are. What are they? What are they? So that wheel is the SDGs, all 17 there, and we have branded all our politicians. I handed a few out this morning to some people. It's a whole of government plan. Ownership is there at government level, and we need people to become aware of the thing. By becoming aware of the SDG logo, the icon, it starts a conversation. And again, as I said, I'll come back to it next as well, but it's about that conversation. If you talk to someone with the SDGs, what they are, you're raising awareness of the 17 goals. You're showing the way forward. So the next plan will be published at the end of next year. There'll be significant stakeholder consultation on that, because I'm determined that as a whole of society plan, everybody has a chance to shape that plan going forward. There'll be a progress report on where we're at in terms of what we've done in the last 2 years, published at the end of the year, next year. The Champions programme will roll every year, because I think we have national champions this year to raise the national awareness. We should have regional, we should have local, we should have community SDG champions as we go forward. September marks the 5th anniversary of the SDGs. There will be a major event planned. It'll involve all sectors of society. And I said, importantly there's a specific youth forum to be established in 2020, because I think we've all seen the youth on the streets of Ireland. They want a voice. They want to be involved in the solution rather than the problem. And that youth forum will be established in 2020 and will bring youth together with policymakers, with politicians, to talk about the SDGs in a positive way that we can work together. There's a lot, as I said, there's a lot of progress been done at a policy level. We have a ban on single-use plastics. We have the Climate Action Plan. Government departments, through their own policies, are advancing the SDGs. The champions have shown that people can work in partnership very successfully with government departments. We have the Irish Congress of Trade Unions working with us, even though they would be traditionally advocates for other issues. They're working with government departments. That partnership approach is the solution to the SDGs. Public awareness is in place on plastics. We all talk about plastics and the scourge of plastics. There's an appetite for movement and an appetite for change. We can lead and demonstrate what needs to be done in the SDGs. And this is where I always pick on someone in the audience, so apologies for this, the person with the water bottle. It's small steps. There isn't one for everyone in the audience before you ask. But we've all seen people with plastic bottles. We're all buying plastic bottles and water. We're all buying plastic water. Why are we not using these? These are about £5 and they're reusable. And you're then part of the solution rather than part of the problem. So it's tiny little things that everybody can do in their everyday life can affect climate action and help us get to the place we want to get to. So in terms of that, look, thank you for your attention. And usually I ask you all to go for it and be sustainable. But I think it's something that every little thing we do affects the environment, the climate and our health. So think very carefully of what you're doing. And as I said, we are happy to talk to everyone about the SDGs, what small steps you can do to improve the world. So thank you very much for your attention.